The process by which we meet and understand and work with a new patient is a very personal process to us. And I want people to understand what's going to happen to them before they come in. In general, that's how we treat every procedure in our office. We go through a great amount of time to explain it before we ever execute it so that patients don't have fear of uncertainties. I've found that it's very helpful in relieving anxiety. Most dental offices you go into, you're going to have x-rays taken, 2 or 3 different people kind of grabbing information along the way, and then the doctor comes in for 5 minutes and tells you what you need. Our process is a little different for that. We really want to take the time to understand who it is we're working with on a feeling level, on a spiritual level, the way Dr. Russ has explained in prior. And we have different levels of care that we offer patients based on their level of need when they come into our practice. For example, we have patients who, because of their history and fear, they don't want to come into the dental office until they physically can't bring their teeth together. They're in so much pain. We don't look at those patients with judgment. We understand that, and we define goals for them at that time. What we could do the best for them at that moment would be to get them out of pain. We're happy to serve patients on whatever level they feel like they're requesting our care. Our preference in serving patients is to try to do it on a comprehensive level because that's where we get the most fruit and the most results of what we're doing. We want to see big health outcomes for patients, and it typically happens when we take a more comprehensive look. When you call our practice, you'll talk to one of our administrative experts first, and they'll go through a process of gathering some information. They're going to request some normal logistical things, names and contacts and emails. From a dental aspect, they may ask you for a recent panoramic x-ray. They may ask you for recent bite wing x-rays. They may ask you for a history based on dentistry.
As you talk to the staff in your initial call, they'll ask for you to include any current lab work you may have, a medical history, and any prescription drug or supplement use you may be using at the time. In our medical history, we collect a lot of additional information that you're probably not used to filling out when you go to a dental office, because we're looking at you systemically. We're not just going to look and consider your mouth. That also leads us into the next part of the process, which is a 1-hour phone call that I'll make to you. There'll be an appointment set, and then you and I will spend 1 hour on the phone discussing your goals, your history, some issues you may have, and if you have any fears. A lot of people are truly afraid of the dentist, and we like to establish a really good foundation and relationship before you walk in, so when you walk into our practice for the first time, you feel like you know somebody and I know you.
Melissa and I will always meet before patients arrive for their new patient clinical appointment with us, which is a 2-hour appointment that's also scheduled on the first contact. She and I will always meet and discuss the patients to try to start to get an understanding and a handle on what their challenges have been and what we can try to do to save them time when they're in the office. Basically, the 2-hour exam process starts in the consult room. We take the time to develop and help people to expand on their health goals. We help them to try to properly assess and categorize issues that they've had in the past with respect to dental treatment and different medical care. And we try to understand what we're all fighting together for. After that, we typically go back into the operatory. We do a clinical exam I call a guided tour, which means that I want to really do more than just look and tell the patient what they need. I want to be able to explain to them and help them, usually for the first time in their lives, understand why they received the treatment that they did. Most patients haven't had a good explanation of why they've needed certain care and why they haven't. So they're really kind of uninformed at knowing how to make changes to create a different process if they didn't understand how the first one started. So that's what that whole exam process is for me, is a process of trying to bring together the treatment they've had, their current goals, and their vision for their health together. After that, we meet with the patient again, we discuss the treatment and all the options, and we start to try to schedule the patient for their first phase of care.